It is not possible to cure hypertension with medications. Drug treatment can only provide symptomatic treatment. It temporarily normalizes blood pressure. It is not possible to restore vascular patency with the help of medications. In previous messages posted on YouTube on the Current Issues in Modern Oncology page, we told you about the healing properties of carbon dioxide. Within physiological limits, carbon dioxide is not only an important factor in activating cellular reactions to restore the structure of blood vessels. An increase in carbon dioxide content within physiological limits has a vasodilating effect and normalizes the functioning of the cardiovascular system. In previous messages posted on the page, we told you about the dangers of deep breathing and the benefits of shallow breathing. Maintaining shallow breathing throughout the day improves human health. We have developed breathing methods, using which you can achieve complete recovery. Today we begin systematic procedures for eliminating deep breathing. The entire process of curing a patient with hypertension is divided into stages. The goal of the first stage procedures is to teach the patient to normalize blood pressure using shallow breathing. Having mastered the procedures of the first stage, patients reduce the amount of medications they take by several times, and sometimes they abandon them completely. If patients improve their condition over the course of 3 to 5 months by eliminating deep breathing, we are moving patients to the second stage. The goal of the second stage is complete recovery. At the first stage of eliminating deep breathing through progressive muscle relaxation during a 30 to 40-minute procedure, the partial pressure of carbon dioxide in the alveoli of the lungs increases within physiological limits. At the second stage, intensive, forced procedures are used to help rejuvenate the human body. Intensive, forced procedures restore and rejuvenate blood vessels. To transfer to the second stage, it is necessary to achieve a sustainable improvement in the condition by mastering the procedures of the first stage. In order to move to the second stage for a complete recovery, you need to master simple ways to regulate breathing and see the result in the form of a decrease in the amount of medications taken and an improvement in your condition. Treatment of severe arterial hypertension begins with the elimination of deep breathing and progressive muscle relaxation. During the progressive relaxation of skeletal muscles in the alveoli of the lungs, the partial pressure of carbon dioxide increases slightly. During the day, you need to constantly monitor the relaxation of the skeletal muscles and diaphragm throughout the day. Relaxation of the skeletal muscles and diaphragm leads to a decrease in the depth of inspiration. You can reduce the depth of breathing while lying down, sitting in a chair or on a chair. You must constantly monitor the maintenance of shallow breathing throughout the day. Breathing should not be deep, visible or audible at all times. Deep and noisy breathing leads to a decrease in the partial pressure of carbon dioxide in the alveoli of the lungs, vasospasm, and an increase in blood pressure. When the depth of inspiration decreases, a feeling of lack of air appears. It is associated with the ability of carbon dioxide to irritate the receptors of the human body. When the feeling of lack of air persists for a long time, a restructuring of metabolism begins and blood vessels dilate. With shallow breathing, the partial pressure of carbon dioxide in the alveoli of the lungs increases and the blood vessels dilate. It is important to monitor the decrease in breathing depth during the day at rest. Therapeutic walking with shallow breathing is added to constant monitoring of breathing. We must learn to walk on shallow breathing. To do this, choose a walking pace that excludes deep breaths. If your breathing deepens while walking, you should avoid excessive exertion and use rest more often until shallow breathing normalizes. Therapeutic walking is carried out on an empty stomach or 2 to 3 hours after eating. It is better to use slow walking with shallow breathing, gradually increasing the duration of such exercise. To avoid stress on the cardiovascular system, it is better to use health routes on flat terrain. In cases where therapeutic walking on shallow breathing deepens it, you need to return to weaker physical activity and use rest on shallow breathing, after which therapeutic walking is resumed. The duration of such therapeutic walking can vary from several minutes to 2 to 3 hours daily. Therapeutic walking with shallow breathing should only be done on an empty stomach. After 2 to 3 weeks from the beginning of the elimination of deep breathing, 3 regular procedures are introduced to reduce the depth of breathing using progressive muscle relaxation at rest. The duration of the procedure is 30 to 40 minutes. To perform the procedure, you need to sit on a chair with a straight back, your chin parallel to the floor. You can nod your head down so that your chin reaches your sternum and relax the muscles of your neck and shoulders. If your back hurts, you can sit comfortably in a chair. The most effective procedures are sitting on a chair with a straight back. The possibility of their implementation depends on the condition of the spine. The duration of the procedure is from 30 to 40 minutes. During the procedure, you need to relax your facial muscles. Relax the muscles of your neck and shoulders. Relax the root of the tongue. Relax your cheek muscles. Raise your right shoulder and throw it freely. Hands on hips with palms facing up. Relax your diaphragm. By relaxing the diaphragm, reduce the depth of inspiration. Exhalation is passive. You only need to limit your inhalation. Depending on the effort, patients reduce the depth of inspiration by 20, 30, 50%. During such procedures, carbon dioxide accumulates in the alveoli of the lungs and a feeling of mild or severe lack of air appears. The degree of decrease in the depth of breathing is individual and determined by the general condition of the patient. Not all patients can perform intensive procedures, and the maximum decrease in the depth of inspiration at first may be several minutes during the procedure. Throughout the procedure, the patient reduces the depth of inspiration to varying degrees. In cases where it is possible to reduce the depth of inhalation as much as possible, a blush appears, blood pressure normalizes, and sweat may appear. This is due to the vasodilating effect of carbon dioxide and its ability to activate the transport of oxygen by hemoglobin to tissues. It is recommended to perform the procedures either on an empty stomach or 2 to 3 hours after meals. It is better to increase the number of procedures beyond 3 after consultation. Consultations are held on Facebook or Patreon. You can see links to Facebook and Patreon on the YouTube page. Current issues in modern oncology. You need to maintain shallow breathing, not breathe deeply, all the time. Every day, while sitting. You need to perform 3 30-minute procedures for reducing the depth of inspiration by relaxing the skeletal muscles and diaphragm. As a result of the procedures, carbon dioxide dilates blood vessels. The patient's well-being improves. There is no need to be afraid of reducing the depth of breathing, since with an exorbitant increase in the carbon dioxide content in the alveoli of the lungs, irritation of the receptors will lead to an involuntary deepening of inhalation. Therefore, during the procedures it is necessary to select a comfortable reduction in the depth of inspiration. To increase the carbon dioxide content in the lungs, gradual intensification of procedures is used. How to perform these more intensive procedures will be demonstrated in future broadcasts. By subscribing to the channel and liking the bell, you will receive a message about the time of the next procedures. Questions can be asked in open chat or on Facebook. Links to Facebook and Patreon on the Current Issues of Modern Oncology page on YouTube.